couple of things. One is we want to make sure that the body's had time to heal from previous C-section, and so typically we would recommend waiting at least a year from any delivery, whether that's a vaginal delivery or a C-section, before trying to become pregnant again. It's a lot on the body to support the growth and development of another person, and so taking a break to just let your body heal, rest, recover.
That's true only after C-sections?
No, across the board.
Across the board, even vaginal deliveries?
Even vaginal deliveries. It is one where you can continue to nurse, you can continue to breastfeed, you can even become pregnant while you're breastfeeding, and that's not a reason to stop breastfeeding. But in general, waiting a year from a delivery before you try to become pregnant again is ideal. Part of it would be why you had a C-section to begin with, and then part of it would be going into labor on your own. It's one where we know that women who go into labor on their own have a much higher probability of success. Ladies who've had a vaginal delivery before and then maybe had a C-section because their baby was in the wrong position or a breech baby, they also have a higher probability of success. Part of it is counseling about whether what caused the C-section the first time is something that's likely to repeat itself, and so it's hard for me to say specifically, but it's certainly a conversation that can be had, getting a little bit more information. And again, unfortunately, sometimes these are just not avoidable, and it's one where there are certain women where if we let them stay pregnant, they would stay pregnant for forever, and certain bodies just don't want to go into labor. And then part of it is there's kind of three parts that we focus on. There's the pelvis, and that's what you're born with. We can't change our hips. That's just how we're shaped. There's the passenger. Babies like to come out with their head tucked like this. Sometimes they're looking straight up. Sometimes their chin is what's trying to come out first. And sometimes we can
Sometimes it's their foot that comes out first.
Sometimes it's their foot. Sometimes it's their butt. And so we can't have too much of an influence on that. And the main thing that we can influence is the power, making sure that you're having strong enough contractions that should cause your cervix to change. And sometimes we can induce people who've had a previous C-section.